CityNews has repeatedly reported on the crisis of mental health care and addictions in Ontario. This Tim Hortons behind me here in Oshawa has switched to drive-through and takeout only, and some say the move highlights the need for more resources and funding.
It took on a life of its own, to say the least.
Oshawa Councillor Brian Nicholson is referring to this Facebook post warning the dining room at the Simcoe Street South Tim's was closed.
There are some people who had political agendas who wanted to simply attack the homeless or attack addiction. That was never the intent. The intent was to say, look, we've got an issue, we're dealing with it, we're not ignoring it.
He says it became a place where there's been an increase in panhandling and addiction issues. The staff tried to help by giving coffee and food, but the number of people grew.
Your humanity and your compassion is tested, and unfortunately it's gone to the point now where there are a minor group of individuals who are really abusing the operation.
Nicholson says that meant closing the front doors to the public, only leaving the drive-through open.
Even with security there, it just wasn't, it was overwhelmed. So he said, well, let's just run the drive-through for the first day and see if we can get it calmed down. Yesterday, he did agree to reopen the main counter.
Durham Regional Police say there have been instances of drug use. CityNews visited on Friday and didn't encounter any issues. But for Nicholson, there's a larger problem.
With the lack of shelter space, the lack of mental health supports and addiction supports, these people are left to their own devices, and they're freezing in the cold, so the only places they can go is to your local Tim Hortons or your restaurant.
When it comes to getting help from the provincial and federal governments,
it's like talking to a brick wall. They simply don't understand the concept of need. It's frustrating for us at the local level. I will say that we have the will but not the money. They have the money but not the will.
We asked the Ford government about the situation. A health ministry spokesperson didn't directly answer our questions. Instead, they pointed to $525 million in healthcare spending since 2019 and a 5% boost coming to this year's community health and addictions budget.
Like everybody, we're seeing as a result of the COVID-19 pandemic, the mental health crisis and the needs for mental health services are on the rise everywhere. And so Durham Region, Ontario is no exception to that.
Andrea Marshall at Ontario Shores Centre for Mental Health Services says they can't meet the demand they're seeing.
The demand far outweighs the resources that we have. I think there's multiple factors at play. Of course, we hear a lot about health human resource shortages, especially the burnout on healthcare workers after the pandemic. So yes, absolutely more health human resources and the resources and supports for those healthcare workers, in addition to more funding, greater system coordination as well would be really important.
Meanwhile, Nicholson says this area
is a great neighborhood. This area is very much a progressive neighborhood. You go around here, you see new businesses everywhere.
But a long-term fix is needed.
We can't keep treating the symptoms. We got to have sufficient funds to solve the problem. So we have to address mental health. We have to address homelessness. We have to address addiction services. We can't simply keep abandoning this to the local tier of government who doesn't have the ability or the funds to meet this need.
In Oshawa, Westoll, CityNews.